Hi everyone, my name is Ibrahim. I'm one of the Internal Medicine Trainees in the NHS. I want to welcome you all today in our course Postgraduate Training Pathway in the UK, an in-depth guide for IMGs. We started this course with a view to guiding all the international medical graduates to give an in-depth idea about how the postgraduate training structure is structured in the UK, and at the same time to enable you to find the information that you need to know about your choice of specialty. At the same time, we will also discuss in depth about how to chalk out your training application, starting from your tips for your training application interview, and all the other questions that is thrown around in different social platforms and also in our Facebook messengers all the time. So I hope if you continue to watch all the lessons in this course, you will find ways to find the right information that you need for your specialty training. So I want to start off with the first lesson today, which is titled as Postgraduate Training versus the Postgraduate Degree. So this is a question a lot of the international medical graduates ask and get confused about, I'd say, because when you try to compare and you don't find the equivalent one, or you don't know anything equivalent, then you find yourself in a situation that I have to do something, but in reality that is not the thing that you're looking for. Just let me give an example. Like in postgraduate degree, what we mean by postgraduate degree in throughout the world, that it's sort of an academic degree. Like you completed your bachelor's degree in medicine and surgery, which in my country it is called MBBS. It can be called different in different countries. So you complete your bachelor's degree, and your next academic degree will be a master's degree, right? So your master's degree, after your master's degree, if you pursue more academic excellence, then you go for a PhD. But it's not the case for professional training though, because after you graduate and become registered as a doctor, you go through your professional training to become a specialist, and thus you can work as a consultant. So the idea of becoming a specialist is not, or not idea, I would say the pathway to becoming a specialist is not similar in all the countries. So as we're talking about the UK, so let's point out towards UK and compare it to the other common, like say Southeast Asian countries or even other countries, because I'm from Bangladesh, so it's easier for me to compare. So postgraduate training is a training, or I would say an approved curriculum that a doctor has to go through, acquiring different levels of competencies. Like as a junior doctor, the level of competencies would be, do you know how to do these procedures? Do you know how to communicate? Do you know how to take histories and all the other things? And as you progress from a junior doctor to a middle grade doctor to a senior doctor, those competencies become more complex, and the responsibilities to gain all those competencies become more bigger, I would say. Like say for a junior doctor, one of the competencies would be to teach a session, and for a registrar level it would be to organize a teaching session. You know what I mean? So the whole way the training is structured this way, so that as you go through the years of training, you become a better and better doctor, and this entire curriculum is made by royal colleges of those specific specialty, or the societies of the higher specialties. Like say cardiology doesn't have a royal college, but probably it has some sort of society. Like gastroenterology has a British Society of Gastroenterologists. In our next lesson, Dr. Ibreez will talk about role of different organizations, so I'd advise you to tune in. So let's go back to our original discussion about postgraduate degree versus training. So training is all about that. You get into a training post where there is an approved curriculum for you to go through, comprising of different competencies that you have to gain through the years to go. Where the postgraduate degree comes. So where do you do masters in this entire situation? You don't. So during the training, it's not necessary for you to go through a master's degree. But a lot of doctors wish to complete a master's or PhD if they want to, so they can take it as an out of program. So you pause your training, go take a master's, come back to your training and finish the training. So that actually increases the length of your training in terms. So a lot of doctors want to pursue the academic ones, like say endocrinology and diabetes. You entered the training and then you want to pursue a master's in something, or you want to do a PhD on something. Then you pause your training, you join this master's course, you go to the university, take classes, take exams, pass the master's course, and then come back to training and finish your training. So that's where a lot of consultants also, after finishing their training, to increase their portfolio, and after they become a consultant, they want to do masters and PhD in something if they are interested in that. But in order to become a specialist, master's degree like MD or MCH or MSc or all those things is not mandatory. That is the main topic of discussion, I would say, in our today's lesson. So postgraduate degrees are not mandatory for postgraduate training. Just to summarize what we were finished talking about, the differences between the postgraduate degree and training, both of the pathways are, even though different, but that they can overlap to some way or form. As you can see, from bachelor's degree you get a master's degree as the next step, and from being a registered doctor you go into a professional training. From master's degree you go and get a PhD. From professional training, finishing your professional training successfully, you become a specialist. But there are other qualifications that comes into play when you are in training. Those are membership and fellowship exams. So in order to progress through the training, as I said before, the training curriculum is made by the Royal Colleges. So Royal College has their own membership exams, like MRCP, membership of the Royal College of Physicians, membership of the Royal College of Pathologists, membership of the Royal College of Obstetric of Gynae. So all those membership exams are the midpoint of most of the training curriculums. So you pass the membership exams, and then depending on what your subject or what your choice of specialty is, you have to either pass the fellowship exam as well, or you have to pass the specialty specific certificate examinations. Like for medicine, every branches of medicine has an SCE exam, which is like, say, for dermatology there will be an SCE exam, for gastroenterology there will be an SCE exam, for acute medicine there will be an SCE exam. So that one you have to pass during your specialty training. So those are postgraduate qualifications related to Royal College which are integrated in your postgraduate training, not the one that are academic or taught. The MD or MS are not a part of the postgraduate training. So I think with a big ramble, I tried to differentiate between the postgraduate degree and training. Dr. Ibreez has a fantastic video in a fantastic location, Postgraduate Pathways in the UK. Check a link there, and let's move on to our next lesson where Dr. Ibreez talks about role of different organizations in your training. Thank you.